Sawadika. Good afternoon. Welcome to Tea Talk live webinar. And today we are here with our doctor, Dr. Chaiyuth Sutheerayongprasert.
Sawadika.
He is spy specialist from Bangkok Spy Academy, Phuket, Bangkok Hospital, Phuket. I'm glad that I have chance to welcome my doctor again here. And I would like to welcome all the audience who are the expat. We have a lot of friends who are living on this island, right? And I'm sure that every day you have many cases, and we are taking care of our expat, our friends who are living on Phuket Island and also the nearby provinces. And how are you, doctor? Are you busy at this moment?
A bit busy now.
I think we have less cases during the COVID-19 period, but actually you're not you still have many cases, right?
Less than before.
Mm-hmm.
Less than before, but still some.
Yeah.
Yeah.
But I think some kind of sickness, we cannot if we have the sickness, we need to come to see the doctor. And today we will focus on the Sciatica. Can you explain about this Sciatica?
Actually, sciatica is a general term. Yeah, refer to the pain over the lower back, pain over the buttock area, pain that going down along your leg. And sometimes it complicated with numbness or weakness of the leg.
Yes. Do you know what? Once when doctor explained this, since I'm his patient, as I say, I bear my history to all of you as well. I'm also one of his patient, and whatever he explained, that's happened to me before. And I'm so glad that I have chance to meet him, talk to him, and also get the treatment done with him. So now that why we said that our topic today is live your life and smile while having sciatica. And I can smile, I have to say, and I can come to work every day. So can we go more in detail about this sickness and why we have to focus if we have kind of condition and what we have to do, sir?
Yeah. That problem, the sciatica, is quite common. It's quite common. So to explain why or where the pain come from, I think we need some presentation diagram to help understanding a bit about our anatomy.
Yes, so we will see the presentation from our doctor to explain.
Actually, that sciatica is the pain that come from our spine. Our spine is the central structure of our body.
Yes.
Yeah. Our spine is composed of a short bone connect together from the top of our neck down until our tailbone or coccyx.
Okay.
Actually, it is not a cylinder. It is a short bone which connect together with a disc. And inside that there is a hole or canal.
Wow.
Continue from the top of our, actually it is continue from our brain throughout the coccyx. So that hole is the place where the nerve is. So if something happen inside that area, pushing on the nerve, it will cause the pain.
Pushing or pressing, yes.
Yeah. So the disc which connect that short bones together, it is a soft cushion material. Soft cushion material with some coverage. It is very similar to the wheel of a truck or the wheel of a car.
Even the truck is very heavy, but if the wheel is in good condition, so we can keep drive carefully and smoothly.
Yeah.
Okay.
Yeah. And the wheel have the outer coverage.
I see.
With the air inside. The disc which connect our vertebra have some coverage and a jelly material inside. So if something happen or some defect happen on the coverage of the disc,
Very interesting.
there will be some leaking of the inside material.
Like the
To
leaking of
contact
the
to-
air in the car trunk.
Yeah.
You said something happened. What can be something that can happen?
Some defect
Like,
or some injury or some crack
oh,
or some leakage or some hole that happen
that
on
may
the
come from
coverage.
accident.
It might be come from accident, it come from overuse, it come from
Overuse.
degeneration, it come from aging.
Oh, we can try our best to protect, but aging. Wow. Let's go step by step.
Some factor we can do or we can prevent.
Yes.
Some factor we cannot.
Like aging.
So if the problem or if something happened on the disc, especially the coverage layer of the disc and the inside material leak out, it will contact to the nerve and will cause the pain shooting down along the leg.
Oh.
But actually the pain start immediately once the coverage is injured. So the pain start on the back first once the coverage is injured. And then when the soft cushion material inside leak out through that defect, contact to the nerve, the pain will move down along the leg.
Oh, I see. So when should we focus or check ourselves? For example, if I have back pain, I may say I work too much today, I walk too much, or I sit too long, and I may go for Thai massage. Is that help, or is that make things getting worse?
I would say if the pain is in the muscle only, and the pain is not a major accident, massage is okay. But if the pain is because of a major accident or suddenly happen after heavy lifting, if you try hard in massage, it will increase or worsen the degree of injury to the muscle, and it will cause more pain.
Okay.
At the end.
So by experience, I facing like back pain before, and I use that kind of technique. Something is getting better, but finally, as doctor just mentioned, the main problem doesn't been checked, right? After that, I have seen the doctor, and it's really getting worse. I have to say, I cannot smile with that back pain. I walk around in the hospital. I go to work and help people, but at the end of the day, I have to get my back checked. So can you tell me once again how to do the check, how to do the investigation until it step into the treatment process?
I would say most of the time, we can diagnose the problem from history or character of the pain and from our physical examination. So we can diagnose that condition and we can proceed to our treatment.
Okay. So patient has to come to see you first.
I would say if they feel some pain or something that not extremely serious, better to rest at home.
I see.
Take over-the-counter pain medications, which is usually safe. Completely rest, put an ice.
So not warm compact, but ice.
Acute pain may be safe for ice.
Okay, ice like cold.
First, except the pain that come and go again and again, you can use warm.
Okay.
But at the pain that suddenly come for the first time, especially after some accident or some heavy lifting, better to rest and ice. Yes. So after you manage yourself at home and it is not getting better, you still not have a good day at home, yeah, please come. And we, as I mentioned, we usually able to diagnose the problem with history and physical examination,
Okay.
except if we smell something wrong, we may use some investigation, a simple X-ray.
Smell mean he used his sense, doctor sense, to detect something,
Yeah,
and
yeah.
you will order like X-ray or MRI, right?
Yeah, or MRI. In case if we think the problem is deep to the disc
Oh, I see. But I think
and the nerve.
that is good, because some friend even called me and said, "What should I do?" But actually, I said even the doctor, sometime talking to you, check your activity, and also physical exam, still need to do the X-ray or MRI.
Yeah.
Until we can make decision what kind of sickness
Yeah.
or symptom it is, right?
Yeah.
Okay.
Often we can diagnose and provide treatment
Mhm.
successfully without any need for the MRI scan.
Mm-hmm.
Yeah.
So MRI will be like the last thing that you may order, right?
Yeah, when we need help from the MRI scan to diagnose
Mm-hmm.
the problem, to confirm our hypothesis, or when we proceed with our treatment and you still not getting better
Mm-hmm.
enough. So for that situations, we need help from the MRI scan.
I think people are get used to X-ray word, but what's the difference between X-ray and MRI, and why they have to do MRI in Bangkok Hospital, Phuket?
Yeah. Uh, we need MRI scan because a simple X-ray can show only a hard bone.
Ah,
That X-ray cannot see the detail of the disc, and
the disc,
absolutely we cannot see the nerve.
the nerve.
But with the MRI scan, we can see the detail of that soft tissue, the disc, and the nerve. Because sciatica is the pain along the leg, which is the pain along the course of the nerve, which is because of the nerve is under pressure by something, especially from the disc, or sometimes from some calcification in elderly. In elderly, sometimes it is not only the soft disc material that leak out, that pinch on the nerve.
So getting
Sometimes
older,
it is some calcification.
getting older, that kind of things getting worse, getting changed, right?
Yes.
But I think also related to our activity or overuse.
Yeah, it is multifactorial.
Okay.
Aging, overusing, overexercise.
Let's say another word. How about overweight?
Accident.
Just say it. Just say it.
Yeah. So we need MRI scan to see the detail of these soft tissues, to see the severity of the nerve
Can we also
under pressure.
Can we also see the circulation?
No, so sorry.
Ah, okay.
No, so sorry.
But that much, yeah.
So in case if we need the MRI scan, we will do it. And I would say, as a doctor who provide the treatment and as a surgeon who perform an operation, we need a very clear image from the MRI scan. So for our setting, for our MRI scan setting in our hospital, so we bought a new machine. We reprogram the machine to raise up the resolution to be better than average. So that's why the time consumed for the MRI scan
take quite longer.
Yeah, take quite longer than usual, because we need a clear, better than average quality.
Yeah. So even the specialists need to see the clear picture to give the right treatment diagnosis But I think not all of the patient need the surgery, right? Because
No.
many people, right, feel like if
No.
I have done MRI in your hospital,
No.
then you will send me to the operating theater.
I would say theoretically, this condition is self-limited.
Okay.
Self-limited, it means it can be better itself.
Oh.
Over time.
Chance, still have chance, right?
With the help of doctor to calm down the situation until you go along the course of the condition to the resolution period.
Okay.
And then it limited or self-limited. So theoretically, the success rate of or the chance that it should be getting better over time is 80%.
Wow.
So it means theoretically, the patient, the people who have who really have this situation, the patient have a chance to be getting better 80%
without surgery.
Without surgery. So on the other hand, only 20% of patients need surgery.
By average. So 10%, maybe only 2% has to do the surgery.
Yeah. So it depends on how good the team is.
Okay. So also we have the team here. So who involved in this kind of treatment?
So we mentioned about the team. So it means not only a doctor.
Not only you.
Not only me. Absolutely. Not only me.
Okay.
Yeah. We also need an experienced nurses.
Okay.
We also need some experienced pain specialists. We also need some experienced team of physical therapists.
Physio, yes.
Yeah, to help, because the treatment is not because of the doctor only. Yeah, we may give you some medicine specifically to the nerve, but we also need a program of physical therapy to synergize the effect of the treatment with all the medicine we use.
Okay.
So and especially we need a patient to be one of our team.
That's the most player.
Yeah, because you have to take care of yourself.
Yes.
You have to modify the way you live, the way you work.
Okay.
Life has to go on. You have to live your life. You have to do your job, but you have to modify some activities.
I'm glad I'm one of a good player, because I'm part of the 80% that I consult with him, and I got let me get back to that day. I think I got the what you say epidural spinal injection.
Yeah.
Is that also part of the 80% that getting better?
Correct. Yes. I would say treatment can be divided into two categories. Yeah. The first category is a conservative treatment or non-operative treatment.
Okay.
Yeah. We should have the success rate of at least 80%.
80%.
And the second category is operation, which actually the patient really needed only 20%.
I see.
So talking about a conservative or non-operative treatment, we usually start with activity modification. Doctor may let you know how, and the patient have to try on their own. Doctor may give them some medicine.
Medicine suggestion. Okay.
A program of physical therapy.
I see.
We need an experienced team of therapists.
Not a normal massage along the roadside.
No. Okay. Sometimes you need special machine at the physical therapy unit.
I see.
So overall, a lot of patients getting better with this, but there still be some proportion of patients that still suffer from the pain. And then after we go step by step, and then the patient still in pain. So that is the scenario for epidural steroid injection, which is a cortisone injection directly into your spine, very close to the nerve, very close to the disc material that pushing on the nerve. So we will put in the needle under a real-time X-ray navigation.
I see.
Or under a real-time ultrasound guided to reach the nerve.
Exactly where the pain is.
Then we bath cortisone to that area.
I see.
Cortisone or steroid will relieve inflammation and will relieve swelling of the nerve. It will calm down the situation. It will calm down the pain.
Can we say how long or how often do we need that epidural spinal injection, or is depend on the activity?
Most of the time, once usually work.
Wow. Yeah.
Only once or second.
Or second time. It's also depend on how patient take care of himself. Right?
Yeah, and depend on how bad the situation is. If something that pinch or pressure on the nerve is very big, sometimes it is beyond the capacity of that medicine to help.
So someone unlucky, the problem can be treated, can be healed. And let me step into those 20% of the patient who need the operation.
And
so how many options do you have, and how long will it take, kind of?
So especially for our unit, for our clinic, we reached 80% success rate.
I see.
We reached it. We reached 80% success rate. So in our hand, only 20% of patient need surgery.
Okay.
And once if someone needs surgery, for us, we do only minimally invasive surgery.
So we do only
the
minimal invasive surgery. All that we call a keyhole surgery.
Yeah, a keyhole surgery under a 3D microscope.
So, I think that is much better than if the wound is smaller, so it will be getting like
less than an inch.
Less than an inch. I just cannot have an image. Like, how can you fix something inside with a very small hole?
So we have to
Sorry, I asked like an aunt who sit next to your house, and I really want to know that.
So only 20% of patients need it.
Okay.
And once someone need it, we will do our best.
Let me ask you, for example, if I need that surgery, if I step into your hospital today, how long I have to be here? And when can I get back to work?
With that kind of surgery, we spend 2 hours in the theater. The patients spend 1 or 2 nights in hospital. They walk the same day. They usually walk the same day of the surgery.
Okay.
So this thing is the same thing as in United States.
Or that means we use as standard.
Yeah. Or in top rate hospital in Bangkok. So we do the same thing, same standard.
So if I have insurance, then I can come to see you and bill my insurance, take care of that expenses?
Yeah, we have team. Our international coordinator will help you to coordinate with your insurance.
Oh, that means I will get the answer maybe before the operation, like pre-authorization, and I can come
something
to you
like
and
and we don't have long waiting list, so
that sounds good. And do I need also like physiotherapies after the operation?
Actually, not a form of physical therapy. You may learn how to get up and get in bed properly. You may learn how to walk properly. You may learn how to modify your life after surgery, which is a very simple thing.
From the first day?
Yeah. So you don't
Ah.
need a big course of physical therapy after that, after that surgery.
That's why we say, even we have sciatica, but if we get the treatment done, we then can get back to live our life and smile during the time that we enjoy our activity. I think living with suffering, it's hard, really. Uh, I don't know how is your condition. If you have the question, you also can write to us. Our doctor will ready to answer all questions you may have. And if we cannot fix everything today, we will send you an email. Just leave your information with us. There are many channels that you can contact us, or even if you want to talk to Dr. Chaiyuth, our website is www.phukethospital.com. And we also have our Facebook, Bangkok Hospital, Phuket. And there are many channels. We also send you an email and you got information from us. You can write back to us. You can send a message to us. And we would like to keep in touch. We would like you to get the right information. And of course, we don't know everything just by calling. Maybe you need to come into the hospital. But we have also the information on the screen that you also can add a line, and you can use our expat link to be like channel to contact with us. We have expat member that come into the hospital, and they also have like member card and connect with us. Is there any question right now that maybe Dr. Chaiyuth will answer your question? But as I mentioned before, some question may have to answer after X-ray or MRI is done. Okay, let's see. I suffer with lower back pain, but not all the time. How do I know if I have sciatica? What is the diagnosis, and what would you advise in order to establish if I have sciatica? Thanks. Maybe the feeling.
So I would recommend the patient to come for us, because we have to interview or take history of the pain. We have to do physical examination on the body of the patient. We may need to do X-ray.
Yes.
In an upright position, in standing position. Sometimes in.
We can do that.
Yes, yes. Sometimes in a dynamic, I would say, when the patient bend forward and bend backward. This is a real time X-ray. And sometimes some patients need MRI scan to get the final diagnosis.
Yes. Yeah. So we are not busy at this moment. You also can make an appointment with 1719, our contact center, and make appointment to see Dr. Chaiyuth. And I think it's the best. Like, if you know that it's not serious, then you may be part of the 80% that can be healed without the surgery,
80%.
right?
80%.
And the next question, please.
The next question.
I cannot see all the questions. It's not in the center. Now, if I live outside Phuket and would like to consult doctor, any solution for this problem, as I can get in Phuket town. So if he is here, it's fine, but he is outside Phuket right now.
Outside,
he cannot come to us.
Sometimes you can email to us. You can use telemedicine to our team. And yeah, we have line contact with our specialist nurse. I see. Would it be possible to get an X-ray done, or maybe after talking to our nurse and get the X-ray done from somewhere nearby, and then send us a picture? I see. Yes, yes. But if the condition is, or even if you have your MRI scan, you can show it to us. Doctor, before the next question is there, let me ask you, if I'm just going and working, I have my back pain sometimes, the feeling like pain sometimes, how do I have to do like X-ray check yearly, or do I have to focus on my back, or just leave it until the pain is there? Normally, we did not do any yearly X-ray follow-up.
I see.
We focus on your clinical.
Ah,
We focus on your pain, your feeling on your back.
I see.
If it's still okay for your daily activities, it's okay.
I think I have got
except you feel something wrong
Uh-huh.
or something changed, so we may repeat that investigation.
That's different from other kind of sickness because I have got the injection by Dr. Chaiyuth long times ago and I can continue my living. I'm not sure, sometimes I miss him. Do I have to come back to him or not? So until I have pain again, then I have to come and see you, right?
Yeah.
Okay.
Until the pain comes again.
And for if we are not better after injection, what would you do if do not do surgery? I mean, for example, if I got a injection done, but my pain is still there, so what should I do if I don't prefer surgery?
Let's see, we may try a program of physical therapy again, or
Like
even we can repeat the injection to see.
Like pain management?
Yeah,
you know,
a pain management program. We also have pain specialists to help us to control the situation. I mean, with a special medications.
Yes.
Special medicine from the pain specialist.
I got the information before from his team. We normally talk about doctor, we normally talk about nurse and physiotherapist, but in his team, we also have the pain specialist. That is very special, and we hate this word. We want to get rid of the pain. So then, how long for the recovery period after the surgery?
People walk the same day as the surgery. Stay in hospital only 2 nights, not longer than that. Sometime only 1 night. But anyway, it may take around 2 weeks until you can drive a car again. 2 weeks? 2 weeks. A car. No motorbike, please.
Okay. So,
but actually, until you feel close to normal again, it may take 4 to 6 weeks.
So when you come into the hospital for the operation, please get a taxi or someone you love drive you here. Don't think that you can drive back home.
No motorbike.
Even you can walk, and no motorcycle. Yes. Okay. So I think that is all for today about sciatica. Thank you so much. But doctor, let me tell you also, when you are coming into the hospital to work, you may see downstairs at the lobby of Bangkok Hospital Phuket. We are quite busy right now. We have the booths and we are selling the special package because every year in during like 15 May until 15 June, this is the period of hospital birthday, and every time people are coming because this is, we know that it's a special time that we are selling the packages. Like we care and we would like to share a healthy package with our people like Phuket and also the expats. So you can connect with us, as I say, via our website. You can also buy and book the package online, and or you can come into the hospital, billing office hour. So this package will be sold on 15 May until 15 June 2020, and the coupon can be used until the end of the year. So hope to see you here, but if you come often to the hospital, you will be healthy. Okay, thank you so much. ขอบคุณค่ะ. Thanks for today. And next week, Thursday, we will see Dr. Captain here. Okay, stay tuned. Bye-bye and have a good day. ขอบคุณค่ะ. Thank you.